This train-the-trainer type of program has created a sustainable program which will continue to grow the number of caring people in our communities who have the know-how to spot mental illness and suicide risks in our children and youth. Mr. President, much has been accomplished in the battle against youth suicide, but there is still much more that needs to be done, and I would like to provide a roadmap of 5 actions this Congress can and should take before adjournment. First, Congress needs to reauthorize the Garrett Lee Smith Memorial Act. Last May, I joined with Senators Dodd and Reed in introducing just such a reauthorization proposal. Our bill would provide some important updates to the program, including allowing states and tribes to get more than one grant so that many states can expand on the work that they started with the initial youth suicide prevention grants they received. Our bill would also allow for increasing funding levels and allow for the current youth suicide resource centers to serve those of other ages. Second, mental health parity has passed both House and Senate and is awaiting final passage. I urge the conference committee to get this to final passage. This final version has been included in the text in the tax extenders package drafted by Senators Baucus that is awaiting consideration. I'm very hopeful that through this package, mental health parity will soon be completed. Placing mental health on parity with physical health will send a very important message to our family members and friends with mental illness. It says to them, we support you, we love you, and we are working to ensure that you get the help you need. Third, mental health parity must also be provided to children under SCHIP. Low-income children suffer at higher rates of mental illness. We must ensure that the state children's health insurance program better supports their needs. We know that the earlier we can identify and help children with any mental health issues, the better chance they will have at obtaining a long-term recovery and learning the ability to manage their illness. Fourth, along with many colleagues, I have long been concerned with the mental health needs of our older veterans, as well as those who are returning from our current conflicts. I held a field hearing in Oregon last year on the issue that our aging veterans face and convened 2 roundtables on the issue with veterans, mental health professionals, and local officials. Senator Cole and I also held an aging committee hearing in the fall of last year that looked at veterans' mental health issues. I was honored that Senator Bob Dole was able to testify at this important hearing. In response to the findings that I gathered from these hearings and discussions, I introduced with my colleague and friend, Senator Wyden, in July of this year, the Healing Our Nation's Heroes Act of 2008. This bill would improve the oversight of the Departments of Veterans Affairs and the Departments of Defense as it relates to mental health services they provide to our servicemen and women and veterans. It would also work to increase the number of their mental health professionals and train them to better understand the unique issues of our men and women who have seen combat. Finally, I have worked to introduce this package of bills with Senator Reed of Rhode Island that would support and enhance our community mental health centers. These centers are really the safety net of our local mental health systems and work to ensure care to so many low-income individuals. These bills would help to better integrate the physical and mental health at these centers. This package would also help to provide funding for infrastructure expansion and improvements that are so desperately needed as local centers struggle under low funding and increased community needs. Currently, the reauthorization is pending in the Health Committee. Mr. President, I know that we are in the midst of a partisan season. 2 of our colleagues are campaigning for the presidency of the United States. and one is campaigning for the vice presidency. In my state of Oregon, my colleague, Mr. Schumer of New York, is spending millions upon millions of dollars running very partisan and negative ads in the hopes of defeating me, and that is certainly his right. I know that Mr. Schumer has put pressure on many of my colleagues on the other side of the aisle these past few months not to continue any bipartisan work with me. But, Mr. President, just as passage of the Garrett Lee Smith Memorial Act was not a partisan issue, taking action on the 5 items I have just listed is also not partisan. Mental illness does not differentiate between Republican and Democrat. It is an American issue. It is a human issue. And as Americans, we have a duty to act. Mr. President, perhaps the best counsel I received in the days and weeks following Garrett's death came from Dr. Lloyd Ogilvie, who served with such distinction as the chaplain of the United States Senate. Lloyd had recently lost his beloved wife, Mary Jane, and called me from Los Angeles to commiserate. His message to me was that gratitude is a miraculous antidote for grief, and that whenever I was feeling overwhelmed by bewilderment and remorse, I should remember to be grateful that the Lord gave us Garrett for 22 years less a day. It sounded simple enough. Gratitude as an antidote for grief. So I tried it. I tried it again, and I discovered that it works. And so, Mr. President, I stand here today, 5 years after losing my son, with profound gratitude in my heart. Gratitude for the countless Oregonians who continue to let Sharon and I know that we are in their thoughts and prayers. Gratitude for my colleagues here in this chamber, without respect of party, who helped me preserve and recover. Gratitude for public servants like Mike DeWine, Chris Dodd, Jack Reed, and many others, and I must mention Orrin Hatch, who has been an incredible brother to me. They allowed me to turn my grief into action through the Garrett Lee Smith Memorial Act. I express gratitude for President Bush for signing this act. He did it on a misty day and an October morning in 2004, just before Election Day. I express gratitude for those who are on the front lines of the battle against suicide, and countless mental health professionals who are implementing the programs authorized by the Garrett Lee Smith Memorial Act, who are often overwhelmed by the demand and underfunded by resources. And above all, I express gratitude that a remarkable boy graced Sharon's and my life for so many years, and that his memory lives on through the good works implemented by legislation that bears his name on the statutes of the United States of America.